Welcome everyone to another wonderful episode here at Jaws Podiatry. We have the good fortune of having a low-level shockwave therapy machine here. It really is and has been a game changer for a lot of reasons. It's another great tool in the toolbox that we can continue to use. Low-level shockwave therapy. This is what the machine looks like. It has a handle, and people get spooked just a little bit when they hear the word shock, right? And it's not really like that. These are low-level shock waves that are actually used to promote healing. In the world of, what we do, whether it be plantar fasciitis, ankle sprains, trauma, or in this case, Achilles tendinosis. Let's talk a little bit about that. A lot of people suffer from Achilles tendinitis, Achilles tendinosis. I'll start off by saying, and I'm going to keep this really brief, anything related to the Achilles, especially in respect to treatment, very difficult. My approach is a very aggressive approach in respect to the Achilles, just because there are certain areas in the Achilles that have very poor blood supply. There's a saying that we don't walk on our hands, we walk on our feet. Part of the problem also is that this patient is very active. He swims like every day, so he's also moving the Achilles. And that's kind of like the hardest part as well. Especially patient battling this problem for more than a year in duration. So we're going to go ahead as an alternative, right? And this is not, I want to be very clear with the public, this is not covered by the insurance. But we're going to go ahead and start some sessions of low-level shockwave therapy. We use because these are acoustic waves, we use a little bit of ultrasound, okay? I'm gonna go ahead and we've already demarcated the area, okay? And I recommend a minimum to start 4 sessions once a week. So every week the patient will come. And again, there's energy and frequency. So we're gonna go ahead and again, there's an area around here, just about here. It's called the watershed zone. We were just talking about it. The watershed zone is a very hypovascular area of the Achilles tendon. Very little blood supply. So, Dr. Wagner, what's the purpose, right, of low-level shockwave therapy? I do consider it a type of regenerative treatment. Basically, what we're doing is we're creating inflammation on purpose, thus hoping to trick the brain into believing that there's a new injury, and the brain will subsequently send the important cells to the affected area, the anti-inflammatory cascade, to try to definitely kickstart, so to speak, the healing process. Okay, so basically, at this point, I quickly stop and I ask the patient, how does that feel? Thumbs up. Okay, great. So the key to this is really to not stay in one particular spot. Again, I have already demarcated. So basically, again, we're going to shock the area about 3,000 times. I can increase at any moment the frequency and or the energy. Because this is the first treatment, anywhere between a total of 4 and 6. We crawl before we walk. Let's go ahead and pump up the frequency a little bit. You guys can definitely listen to And again, you want the coupling gel, right? To help those waves to really penetrate. Not a lot of clinicians have this machine in their offices. But in my short career, I've noticed that it's a great tool to have as an alternative, right? Non-invasive, no anesthesia, lunchtime procedure. Patient walks in, walks out. Just some of the pros, right? Cons? None. And eventually it has a numbing effect. No question, it's a great procedure. You know, when it comes to the Achilles, there are not a lot of treatments out there, effective treatments. Cortisone injection into the Achilles, controversial, but it's a no-no. At least in my book. PRP, stem cell therapy, adipose-derived stem cell therapy, physical therapy, immobilization. We're gonna go ahead and crank the frequency a little bit more. How you doing up there, patient? Thumbs up, great. Shock, baby, shock. Right? That's the saying. Come around here. Cannot forget there are obviously some important neurovascular structures in the area. We're very mindful of that. You know, some people go really slow like that. I tend not to like that technique. I kind of like to just continue to move around. In the world, I mean, even from head to toe, I have a couple of good friends that are, you know, pain management specialists, orthopedic surgeons. They use low-level Shockwave also as well. For patients that may want to avoid the knife, but if you know what do we use it the most here for? Achilles tendonitis, tendinosis, plantar fasciitis, plantar fasciosis, also known as heel spur syndrome, ankle sprains. The sky's the limit, really. I know this is the area where he has the most pain. No ice, no anti-inflammatories after the procedure. But why not, Dr. Wagner? Again, we're actually trying to promote inflammation. just like that. You know, I had recommended that Caesar try this. he ran out the door like a wild banshee.
I'm good, Doc.
I'm not sure why.
Oh, thank you.
So, you know, again, just like that, about maybe 7 or 8 minutes, we're done. Patient, how did that go?
I didn't feel anything.
I mean, me neither, but how did it go?
No, it went well.
Went well, right?
Yeah.
No pain?
No, nothing.
You know, again, you know, we start first time today slow. We crawl before we walk. Next time, we already have the parameters. We'll probably, you know, pump up the volume, so to speak, and then, and that's how we will continue to monitor, obviously, progress as well.
Okay.
Okay. As always, number one, for all of the viewers out there, if you like this video, please give us a like. Please ask questions, comments, anything. I'll definitely I'll try to get to every single one of them. Also, on our YouTube channel, we continue to upload videos on a daily basis. Make sure that notification is definitely on. If it's not, you will not know, when we upload. And people are always asking me, well, you haven't uploaded in a week, and that's not the case. As always, thank you for watching.